Hello everyone, welcome back. So, here's something many people don't realize: Medicare plans change every year, and if you don't review yours during the open enrollment period, you could be paying more than you need to. For 2025, there are some big updates, like a new out-of-pocket cap for prescription drugs, and it could make a huge difference in your health costs. Today, we're going to look at how you can take advantage of these changes and make sure your plan works for you. If you want to make sure you're getting the best possible coverage at the right price, you'll want to stick around. So, Medicare Open Enrollment happens every year, and it's your chance to review your coverage, see if it still fits your needs, and make any necessary changes. From October 15th to December 7th, you can switch plans, add new coverage, or just make sure you're not paying for something you don't need. But for 2025, there's an important change you should know about. The out-of-pocket cap on prescription drug costs is being lowered to $2,000. That's huge, especially for those of you who have been spending a lot on medications. It's a big part of the Inflation Reduction Act, and it's going to bring some serious relief for many people. Now, let's talk about what you can actually do during open enrollment. First, if you're on Original Medicare, meaning you've got Parts A and B, this is your chance to look into adding a Medicare Advantage plan, which can include extra coverage for things like vision, dental, and prescription drugs. Or, if you already have Medicare Advantage, you can switch plans or even go back to Original Medicare if you feel like it's a better fit for your needs. And if you're on a standalone drug plan with Part D, this is the perfect time to make sure that plan is still working for you. Plans change every year. Sometimes they stop covering certain medications, or the price for your current medications goes up, so it's worth checking. Speaking of prescription drugs, with that new $2,000 out-of-pocket cap for Part D in 2025, it's a good time to see if your current plan will give you the best deal. Some plans might have better deductibles or copays, and if your medication costs are high, this cap can really save you money in the long run. And there's also the option to spread out your prescription drug payments across the year, instead of having to pay a lump sum all at once. So, if you're someone who's been struggling to cover all those costs at once, this could be a game changer for you. Also, it's important to know that if you're looking to switch from a Medicare Advantage plan back to Original Medicare and you have any pre-existing conditions, you'll want to check on your options for Medigap policies. In some states, it can be harder to get Medigap coverage if you have certain health conditions, so that's something to keep in mind. But there are a few states, like New York and Massachusetts, that offer protections, so if you live there, you've got more options. Now, one of the biggest mistakes people make is not reviewing their plans every year. In fact, only about 30% of people on Medicare take the time to do this, and it can make a huge difference in your coverage and how much you pay. Even if you're happy with your current plan, it's worth comparing options. Needs change from year to year, and so do plans, and what worked well for you last year might not be the best fit now, especially with all the changes coming in 2025. So, how do you actually go about comparing plans and making these decisions? Well, Medicare.gov has a plan finder tool that's super helpful. It lets you compare different plans based on your medications, your doctors, and your location. You'll also want to look out for the annual notice of change, which your current plan should send you each fall. This notice tells you what changes are coming to your plan, whether the premium is going up, whether certain drugs are moving to a different cost tier, or if your favorite doctor is still in network. And if you feel a bit stuck, don't worry. There's plenty of help available. Each state has a program called SHIP, which stands for State Health Insurance Assistance Program. They offer free, unbiased help with all things Medicare, and they're a great resource if you're feeling confused about your options. One last thing I want to mention is that you don't have to rush your decision. I know the December 7th deadline can feel a little stressful, but you've got plenty of time to think things through and make the best choice for you. Just remember that any changes you make during this period will take effect on January 1st, 2025. So, whether you're considering switching to a Medicare Advantage plan, adding prescription drug coverage, or just making sure you're not overpaying, Medicare Open Enrollment is your chance to get the health coverage that really works for you. If you've got any questions or experiences to share about past open enrollment periods, feel free to drop them in the comments. I'd love to hear from you. And if you haven't subscribed yet, be sure to hit that button so you don't miss out on future updates that can help you make the best financial decisions. Thanks for watching, and take care.